Hello, and welcome to Facebook Live with Dr. Brie. I'm coming in today with reflections on 10 years in direct primary care and why you should consider direct primary care near you and how you can find someone and how to figure out if it's the right fit for the current healthcare problems that you might be facing. So, we know a lot of people are up against rising premiums, and every, couple of years, you get into a new age bracket, and we see some big changes, particularly at like 60. People start paying quite a bit more for health insurance and healthcare in general. So I want to just give you some tips on direct primary care to think about and how you can kind of evaluate a direct primary care near you and see if it fits within some changes you might make with your next open enrollment. Or if you're a small business owner like myself and you're trying to figure out how to meet the demands of, costs and keeping your overhead low, how you might adopt this as an employer, because many people are using direct primary care paired with a HSA plan or a high deductible plan for the most affordable, best bang for your buck, but also great quality. And there's quite a bit of information out there on that. In fact, Hint Health has some great reports on employer trends and direct primary care trends over the last several years. So I'll link those in the comments. The first thing about direct primary care you have to know is that you're making a relationship directly with your provider. So it's super portable. If your job changes, if you have insurance, you lose insurance. If you have this insurance and then you have a different one, if you're, somebody who has a lot of change in the department of your healthcare coverage or lack thereof, direct primary care is nice because your doctor and your provider stays stable the entire time. So many people, this person's on their plan and then that person is no longer on their plan. So they have to switch everything. Sometimes you have to switch whole health systems, like from Kaiser to non-Kaiser. So, you can have Kaiser and pair with a direct primary care clinic. You can have United Healthcare. You could have no insurance. You really can have whatever plan that you want to pair with the DPC. Remember that direct primary care and primary care in general, prevention, is like, your oil changes in your car and putting gas in there, right? It's preventative. You got to do some maintenance every once in a while, do your wellness visit, make sure everything's working right. But your health insurance should really be saved for a collision with the healthcare industry. It's like your car insurance. So it should cover an accident of, a medical nature, a major health event, hospitalization, a surgery. We really have, evolved past the mindset of health insurance really covering everything, as you know, between deductibles and copay and co-insurance and bills that you just don't expect coming or don't see coming. That is the paradigm of health insurance, and it's good to have. It's good to have that coverage. I'm not saying you should not have that coverage, but you can make that coverage kind of really for what it's for: catastrophic, big problems, medications that are expensive, and then use your like day-to-day direct primary care as, your oil exchanges and your gas, right? And your annual maintenance. And many of us have our prices right on our website. The next reason I love direct primary care is cost transparency. We have a whole pricing page on our website for direct osteopathic primary care at mydenverdo and myparkerdo.com. But you can see literally how much everything costs. You can see all of our self-pay lab panels. You can see exactly how much it's going to be. And healthcare should be like that, and it's not often that way, but that is a great reason to choose direct primary care because you just know what you're getting into. And your provider should be able to tell you what it costs to do an insurance MRI versus a self-pay MRI, at least a ballpark. Most of us are your cost-conscious healthcare shoppers in your local region. We'll say, go here for this, go here for that, and we're always looking for the best quality, but also the most affordable option for our patients because so many people in a direct primary care model use some sort of self-pay, whether it's because they're avoiding a high deductible or whether they don't have coverage at all, or they're using a health share, which is another option. So the next reason to choose direct primary care, of course, the number one reason in my mind, but the next reason for most patients is the relationship with your provider, like we talked about, but the access, right? Being able to get in when you need to, being able to talk to somebody when you're concerned, and avoiding those unnecessary trips to urgent care because your doctor is booking out 2 to 3 weeks for a urinary tract infection or checking a strep test or making sure you don't have COVID or whatever it is. So, if you need that access or you benefit from that access because you're your life is busy and getting into, an office is just challenging. In the new paradigm, it can take 3 months to get a new doctor, and many times there's something that you need that you don't need a high level of catastrophic care. So if you have that direct primary care relationship, you can have a go-to right away, and that's why you compare it with something like Kaiser, because you can come to us for the day-to-day, and if something is needed through your insurance, we say go to your Kaiser primary care doctor and ask them for an MRI, right? So we can kind of advise you how to navigate the system. We're in your corner about that. The other thing is we're all unique. Every direct primary care outside of those things is, well, I'll tell you the definition in a second, but every clinic is very, very unique. And our clinic is holistic focused, osteopathic focused. We have really cool enhanced care options with Reiki and heart math and direct treatments with osteopathic manipulation. And then we also have our personalized health assessments, which are alternative medicine, our deeper dives that get more information, but you don't have to have that. Those are all add-ons in our option. For our direct primary care at Direct Osteopathic, and everybody's really different. Not everybody is the same in DPC, even in the same city. We're all very unique. Because we're physicians or mid-level providers, nurse practitioners, and PAs who have a passion in something, and we wanted to hang a shingle around it, and here we are. So you can kind of find what fits your needs. Some even really focus on, obesity or the GLP-1 medications, and you can have direct access to a provider that has that expertise. We have that in our Healthy Living program. So you don't have to look beyond our clinic for that, but there are clinics that's just their focus, right? The next thing that's great about it is you have a small team. You have a dependable small team that's personable. Everybody knows you because our panels are a lot smaller. Most direct primary care physicians will see a panel of 200 to 600 patients per provider, and in the typical world, it's usually 2,000 to 5,000 patients per provider. So you just have a much more direct, literal relationship with your provider, and they know you, and you can consistently see the same person and choose to see the same person when you need to. So that's a huge benefit, and that's the quality of direct primary care. So what is it? It's a monthly membership. You don't use your insurance at all to have an office visit in the clinic or to be seen for primary care. So what it is not. Concierge medicine, right? So concierge medicine is when you have a fee for the membership, but the provider still bills insurance. So they still bill your insurance also for that office visit. Usually it's a lower monthly fee. Sometimes it's a higher monthly fee, but either way, a concierge doctor will also bill your insurance. So it's not like DPC is cheap concierge that gets around in the rumors, but it's actually a totally different animal. You don't use your insurance at all for anything that it takes place inside of our office. If we send it out of our office, like labs, pap smears, imaging, referrals, then that can go through your insurance or your health share or self-pay. We will help you navigate that, but nothing that happens inside of our clinic has an insurance billing from an office visit perspective, wellness visit, sick visits, skin lesion removals, joint injections, things like that. Those are all covered under the direct primary care membership. So the definition is that you can't have a periodic fee that is greater than the monthly fee. So our monthly fee is $99 a month. And so, direct primary care, by definition, they don't have those per visit fees that are going to be higher than $99. So that is very applicable to many direct primary cares across the country. And now, just based on the changes last year in the legislation, you can use your HSA or FSA card for that monthly membership as long as it's below $150 a month per member. And that is making it so much more affordable for people on a high deductible HSA plan to be able to use that card towards the membership fees and any self-pay labs, because our standard lab panel is $65. So it's a really great lab panel that even includes a vitamin D level, and you don't have to pay more than $65. So many people will pay that out of their HSA and not even use their insurance until they need, fancy labs or bigger lab panels for something more complex to work up. So that's direct primary care in a nutshell. You should definitely look at it. If you want to do DPC math, this is what I recommend during open enrollment. So go on whatever healthcare benefits website you're looking at, whether it's through your employer or you're purchasing on your own, and really toggle the button between a low deductible plan and a high deductible plan. And if that savings is around or more than $100, then you will probably save money by doing direct primary care. High deductible plan with a direct primary care membership, you're going to save money on your monthly premium to do the high deductible plan, but the direct primary care will supplement so that you have some access, you have prevention, you have labs, you have navigation of the healthcare system to prevent that catastrophic collision with the healthcare industry and actually using your deductible. So that is the way to figure out if direct primary care works for you. You can also go onto the many health shares and see if those premiums and adding that to direct primary care would be more affordable for you or for your employment team. There are some people who are in benefits who know about direct primary care, and hopefully your company is one of them that is innovative, trying to give you good quality and also more affordability. So I hope this helps understand how direct primary care can help you lower the cost and improve the quality of your healthcare.